Good afternoon and welcome back. I'm Roberta Lavin, and we've invited members of the Planning Committee to help us reflect on the workshop. So I'm going to start the panel out with basically giving each of them an opportunity to give a couple of minutes about their big takeaways from the workshop. And then we have a series of questions we are going to walk through. And we also invite other people to suggest things that we might want to address in the Q&A section. So if we want to start out, I think I will just start out by asking Heather if you want to give a few comments on your takeaways.
Thank you, Roberta. And boy, there are a lot, and trying to keep that down to just a couple minutes. My goodness. So I worked with the parents and guardians group, and a couple of the themes that came up in there was we all talk about the criticality of the infrastructure that supports children. We talked about the need for enabling childcare and schools to be available both for parents and children, for children in the aspect of restoration of routine, and for parents and guardians to enable returning to work and rebuilding community and that sense of normalcy for themselves. Also we talked about some other issues I hadn't thought about originally, the need for stable housing and a return to that stability post-disaster. The failure to do so contributes to the stress of parents and guardians, which can impact the children and their ability to recover. But it's been a great workshop and a lot of great points brought up by everybody.
And Sherlita, what are your takeaways?
Well, Roberta, as you started us out this morning by saying we have heard for the last 2 days that children are the best way to change how we prepare. And we have also learned over the last 2 days that there remain research gaps, funding and support gaps, and there's a need for the development of evidence-based interventions. We also know that disasters begin in locally and that planning needs to be local as well, but leadership really needs to be at all levels. Our children can be empowered with an understanding of the risks and knowing what protective actions they can take, even if those actions are small ones. And with this knowledge, it allows our children to be more confident during an actual emergency, to remain calm, be less anxious, enables them to be active participants, even if it's something as small as just developing their own go bag. And it encourages a lifelong interest in preparedness. It's also important to consider the whole family when we do our approach. Programs should work to build resiliency both in children and in the adults in their lives. And so this can't be done in isolation and requires agencies to have a multi-generational approach. And we also need to integrate knowledge about the impact of childhood trauma and incorporate these issues as we develop our policies, our procedures, and our policies. And lastly, I think we need to enhance our mental health support. I think that psychological first aid is an outstanding program, and the availability of services for children to learn to cope with the impact of trauma will enable them to get through almost any situation they find themselves in. Thank you.
Thank you. Dr. Simpson.
Yes, thank you, Roberta. I think that the things that I took home mostly from the panel so far has been the importance of a web, an interweaving of the services that we do provide to care for kids, whether it's in the education system, the healthcare system, social services systems, case management, that we are doing a lot of good work, a lot of lessons learned since Katrina, but that we also need to be thoughtful about the data that informs our services so that we're not doing duplicative work, and that we're also enhancing each other's work to serve the kids and the adults caring for them. So I think I echo everything else that the other panelists have said so far, and I would add that.
Thank you. And Captain Somers.
I'm off mute now. So I would say one theme I heard is working with communities. And helping to ensure that groups within communities that are always in communities before disasters and then are going to be there after disasters have access to programs and services that are available potentially at the state or federal level. I think so that piece of working with communities, I think, is really important. And then also a need for ongoing and continued collaboration across different sectors. So after a disaster, the folks who reside in sort of the emergency planning response sector are already connected to people who are in like the early care and education sector. So those connections are made before disasters. Then after disaster, it's easier to work on a project or solve a problem moving forward when you already have those connections made and know sort of each other's language and how to move forward together.
Thank you. Yeah, one of the things that we always want to try to address is where can the infrastructure be strengthened? And to start this out, I would say that back in my days when I was working on critical infrastructure for public health and healthcare, we did kind of an exhaustive survey of what the infrastructure was and what part of that was critical. And I think when we look at the human services infrastructure for human services and social services, especially as it relates to children, there hasn't been that type of exhaustive structure. And I think it sometimes leaves us wondering what exactly is the infrastructure. So we go back to schools and childcare facilities and why do we not have a sector in the critical infrastructure that is human services? So I would ask, what you think about what can be done to strengthen the infrastructure and what can we learn from?
I'm happy to start with that one. I think one of the things I heard, especially, and I think I was invited to this panel with my experience, probably on the healthcare side as a pediatrician, and so what I learned is that the social services, not to mention, of course, the educational services provided to kids in the school system, those are sort of the first thought of areas for when a disaster hits of where people can seek resources, probably often they're designated shelters, but also an area for food dispersal and security for families and children. But I think that in disasters, we're realizing that the tax on those systems are already so great, even though they have planning, continuity of operations to weather through the storm themselves, but that we also need to build the capabilities of other services in our communities to support those systems. So I already am thinking of ways I would take home lessons for our hospital system, for instance, to do more targeted outreach to social services, to school systems where we can better partner to build that infrastructure in our communities to serve kids.
Thank
And
you.
Roberta, if I could too, again, I go back to, childcare needs to be designated as critical infrastructure for a lot of reasons we've talked about, the recovery and needs of children, for enabling parents. One of the things, like I said, right now it's currently considered small business. But because like 60% of childcare out there is for profit, but there is a much larger impact to the community when the local childcare closes than the local diner. And there is no distinction made now in the world of grants and funding and loan availability, the way we look at it. Another point to what Dr. Simpson just brought up too, on public health, especially mental health, there is no natural, I don't think, connect between childcare and mental health support services. We've gotten into the schools, we don't get to the childcare. And children of all ages, as we know, are affected by loss issues as well as trauma. So I think that somehow we need to figure out a way to draw that connection across to enable businesses, but the ones that support all of our children, in a way that's never been done before.
Yeah, and to add to that, I think Byron posted earlier in the chat box that out of the 3,896,000 child care settings in the United States. 3,767,000 of those are homes. And that the child care facilities that most of us envision is only about 129,000 settings across the country. It does make it difficult, and it certainly makes it harder to think of. And yet we think of banks as critical infrastructure. And so, you know, and so how do we get there? It's something that needs more thought.
Yeah, I was going to say, I think when we think about infrastructure too, sometimes we're talking about the actual physical space, like infrastructure, like for example, a bank, you're thinking about the actual physical, what pops in your mind is like the physical being, or the ATM having electricity, like that's sort of a physical component. But then there's also the services that it provides. And I think sometimes with childcare and early care and education, even schools, you know, we have to, when we're talking about infrastructure, I think probably for a lot of the emergency response community, infrastructure is physical space. Like, does it have water? Is there electricity? And the services side is a little harder to wrap your head around everything that infrastructure might provide for services. So maybe there's a way to start thinking about these infrastructure more holistically from space and services.
Absolutely.
And I would say that although this conversation is not around COVID, in New York where I am, we've been very hard hit, and we've had to put a lot of people into quarantine situations, which means that we are being asked to provide for all of their needs that they can no longer meet. And so I think this is putting an emphasis on this area that has not been previously there. And I am hopeful that we will learn a lot from the situation that we're going through now that we can use in other disaster-related events.
Yeah, and I think some of this might lead us into that we did have, even from today, we had some examples that we can learn from the Children's Task Force in Puerto Rico and the success of psychological first aid and child care disaster planning requirements. I think all of those are things that we knew that we could learn from. But I think the other thing to think about is, knowing this, what do we think is the most urgent work that came out of these 2 days?
Roberta, I'm sorry, go ahead, Sherlita.
How about Heather and then Sherlita?
We need a traffic cop here, I'm sorry. No, I think, Roberta, you've said it, and I don't think we've said it enough, but everything that we're talking about points to the need to create a human services sector and critical infrastructure definition. And because all of the things we're talking about, I mean, they are some tangible structures like, you know, child cares and schools, but it's the services that all of these things provide, that mental health provides, that all of these other things that provide, that's not covered at all in there.
Thank you.
And actually that was essentially what I was going to say. I think that that's really an unmet need that I do think sometimes people think it's just impossible to accomplish, but I think if we take it piece by piece, that you know, you can do anything if you start small and build up. And so trying to not just create the situation, the system in totality all at once. I think if we take individual pieces, that we can be successful, and we should not let it just be so daunting that we don't even attempt it.
I think once again, I borrow from my lens of the healthcare system, where we, you know, think about clinical conditions, for example, and the evidence base and the data and the research that applies to different types of populations to treat particular illness. And when we think about disasters, I think that Dr. Schoenfeld especially highlighted the data that's needed to measure the effectiveness of a lot of model programs that are being built at the local level, a lot of efforts that are being put into mitigating the impact of disasters on kids that are not yet there in the literature for us to learn from across our various communities, so that we can have a benchmark of what are best practices out there for the various situations, the various age groups of kids, and their adult supports in the community to move forward.
Yeah, and you know, it's interesting because Lori Peak just made a comment that that she liked the discussion about the infrastructure, and pointed out there's a wonderful book, Palaces for the People, that is about investing in physical infrastructure that supports our social infrastructure, so schools, parks, libraries, and childcare. And I would say that if we first addressed this, that we consider the critical infrastructure of human services, then we could probably get to the piece about how we support service providers and how can we build on the capacity of the BOADs to see how children needs can be taken care of during a disaster. I think in many ways, it helps us to think, what are the initiatives that might have the most impact? I mean, if we could say, what's an initiative or what's an actionable item, something that we could think about as our next steps, what do you think might have the most impact?
Roberta, one of the things that we talked about was the value of the utilization of the Children and Youth Task Force. Now, we also talked about how that particular structure might not be applicable to every area, because I mean, it's going to have different membership, it's going to take different design, be led by different people. And sometimes it does boil down to a resource issue, be able to devote people and time to it. But if we can get more of these things into the standard way of emergency management planning before the disaster hits, instead of creating that children's appendix at the end, which we've all talked about, just it doesn't address the problem at all. I think that might be an initiative where we can start to have those, at least identification of needs and resources up ahead of time, and maybe be able to start working to resolve them before something happens.
I think there was also a comment by one of the panelists about the fact that there are programs that do exist right now. There's a lot we have learned from Katrina, but at times that maybe there was a suggestion of technical assistance being provided in order for us to better access those services. So I think now we're sort of getting into deeper layers of how to not just establish those services that need to be there for our communities, but now thinking of how do we get it to those that most need it, how to operationalize it better in terms of our planning, and being able to measure the outcomes of those services so we can build on them even further as we go through and learn from each disaster that we're faced with.
Well, you know, one of the participants online actually just said, and one of the things we need to do if EMS in your local communities isn't addressing this, you need to knock down their door until they do listen. And I think that also adds to the fact is that we needed accessibility to resources to increase the number and integration of child nodes of the BOAD, so that they're not just all connecting to that one place, and that one place is Save the Children, that we need a bigger engagement. And I think part of that does begin with our emergency management system. But I also think part of it begins with a bigger leadership role for the human services people, like organizations like ACF, because certainly in large scale disasters, you need the bottom up, but you also need the top down.
I think children shouldn't be an afterthought. I mean, I've been in this business many years, and it always seems like we plan for everybody else, and when we're done, we plan for the children and for the special needs population. I think if we would flip that paradigm, if we planned for special needs populations and children, we'd be able to take care of everyone else, because we would have had the most difficult taken care of first. I think that it just makes a lot more sense. And children are our future. They should be the first thing that we think about and not the last.
And I think Dr. Schoenfeld was also, and Lori Peak were echoing some of that. It's one of the things that people often say, well, we take this utilitarian approach, the greatest good for the greatest number. And I'm like, okay, so the wealthy and the healthy live and everybody else gets ignored. So I've always been kind of opposed to that approach, because I think you're right. If you take care of the people who have needs, that everyone else is taken care of along the way. So one of the things we need to think about is, we think about what are the things that we can do that we think might be promising or have a greater impact. And I think if I had to put it at the top of my list after the last 2 days, what would have the greatest impact, that it would be that there is a plethora of data that's out there. And the problem is the people that are doing the people that do the research and can take that and funnel it down into evidence largely don't have access to that data. So I think we need to make data more accessible. But there are other things we need to address. Addressing school closures as it impacts food security. I thought that was huge. And so, and I would think that that needs to be a high priority. And then some other policy changes that should be simple, but I know they never are, is the emergent electronic benefits transfer and advancing benefits before an imminent disaster. I thought those were excellent ideas. I don't know what you guys heard and thought were imminently doable or important. Most
so Roberta, one of the things that I heard, I believe it was from Amanda, she was talking about the lack of understanding of the SBA loan process for like child cares and child-related services. One thing I found when I was doing my research from a dissertation for Superstorm Sandy was the same thing. People just didn't know to apply. We're looking at, child care providers, they just didn't know, they didn't understand. And I know the SBA does a lot of work to put information out, and I'm not trying to ding on that, but I think we need to go to, NAEYC, CCA, the different child care professionalization organizations, go out to the community, the licensing folks in every state, ACF, of course, and make, provide more training and information on how to navigate the system and what your options are before the disaster hits. That might be something that we can do from a preemptive education way.
Yeah, I think so.
This is, oh, sorry. You can go ahead. I was going to say, I think something too that Professor Peak said earlier today that I think we've found in some of the work we've done at ATSDR around environmental health and children's exposures to contaminants, environmental contaminants after disasters, is she mentioned how a lot of people in one profession, like that was the childcare profession, they were seeking information from one source, right? So if you're seeking it just from that one source, then that source of information, although very good in its field, is not pulling then across those other professions to bring in other ideas and other ways to maybe think about problems and address these issues for children. So I think, again, some of that is that building the collaboration across different partners, either at the community level and at the federal level, so we can turn to each other when there's a problem. Now, for ATSDR, we've done a lot of work in this environmental health issue with early care and education. And now I have friends at ACF who I never knew before this work, but we've established that connection, and they'll say, hey, I have this issue now. Can you help us with it? And that didn't exist several years ago. And it's only because we tried to break down those barriers between the different sort of professional groups. And, these groups do early care and education, we do environmental health, others do mental health. And when it comes to kids, all of those things are important, right? But we're kind of still a bit siloed in our thinking and often in our response. And I think that's something we can all work to, make better as we move forward, taking data and best practice and putting it out to more groups so they all have access to it.
So one of the the comments I got was that children spend much of their day in school settings, and schools are places in which education takes place. How can schools be better used for disaster-related education of teachers and students, and perhaps for community members and BOAD volunteers?
I actually think that there should be regular education around disaster preparedness, teaching, like starting at kindergarten, what children should do, what should they know. And I also think that children should be more involved in disaster related drills. In public health, we spend a lot of time drilling how to do pods, how to do point of distribution, how to do other drills. We almost never include the pediatric population in the actual drill itself. So most of our planning is on paper. Very little of it is actually practiced at any kind of level. So I would love to see children be actively involved in a variety of disaster-related drills, because I do think, as I said in the beginning, that the more they learn about it, the less anxious they are. And when something actually happens, they'll know what to do. And an example of that is teaching children, CPR or to dial 911. Then if a child is there and something happens, they may be small, but they know what to do, and they do it, and they're successful.
And I think Trevor Regan gave the great example of that yesterday with the child that saved his family's life because he was taught what to do in a fire.
Exactly.
Another question is for Mary Riley was that there's an ongoing effort in the past years is to strongly advocate that state human services divisions of children and families are integrated into state emergency management planning. And the question was, do we know if that's happening now? I don't know if anybody knows the answer to that question. I know that I do not have that connection now to know the answer. I do know that it used to happen, and certainly it was a big push by ACF to do that. The other thing to think about is how can we account for pre-disaster vulnerability within children who may be in the child welfare system? Should we take those pre-disaster conditions into account? And if so, how?
Well, I think certainly these children have trauma in their life, more than likely, which could put them at greater risk for, as we know, both health-related mental health conditions, and certainly less likely to, I think, do well in a disaster-related event. So ACEs brings that kind of thought to the fore. And I think it is something that we should consider. And I do think that foster parents and children, people who have children that are, that they are sponsoring in any way, should have some basic understanding of disaster preparedness and have at least some kind of basic plans for how they're going to manage an event that happens while that child is in their care.
I wanted to add to that too, because I 100% agree, is that I also think that there was an opportunity raised by the panelists about the gap in just sort of basic community understanding of the natural grief reaction across the entire population, regardless of ACEs or predisposing conditions, that there's a need for us to maybe learn the CPR of the grief response, of tragedy, of coping across our communities, so that not everything is necessarily rising to the level of needing, for instance, specialized mental health services or behavioral health specialists, but that we all have a capacity, especially as adults, to be able to understand or support children in a evidence-based way that we can probably deliver through psych first aid or other systems that are working in other communities, but we haven't shared them across our systems.
Yeah, I think now we might be at a unique time in history where there's a lot more talk of equity and justice. And this might be a good time to really help understand better the unique vulnerabilities of certain communities within our larger communities, and especially for children. And, you know, we can work across that in all of our sectors, even environmental health, which I'm in, you know, environmental justice, environmental equity. Now's the time to perhaps bring it up again, because it seems like we're at a good moment for that to resonate and be heard by many people.
Oh, I absolutely agree with that. So if we think about all we've seen the last couple of days, how can we think about monitoring and evaluating the performance of our response and recovery efforts related to human and social service? And to me, one obvious way is to fund human services specific disaster research, and to encourage researchers who are out there to use the available ACF and VOAD data for assessment. But if you had to think of more of a holistic approach that includes government agencies, what can we do to monitor and evaluate so we have the evidence, so that we have evidence-based programs and response?
I think sometimes it's best to look after events happen and then the lessons learned. I mean, you really see what worked and what didn't work. It's not theoretical. The data can be readily available, and just take a look. And I think right now, after COVID, we're going to have a real opportunity to learn how our system functions, and can we provide for our most vulnerable families during this event. It's not, you know, not a hurricane or a natural disaster per se, but still some of the issues are going to be the same. And so I think after any kind of disaster, whether it's a hurricane or a major storm, there's always things that we can learn. And I personally like that kind of research rather than the theoretical research, because it's just, I think, more evident where the holes are.
Yes, I think there's a lot to say for more community-based participatory research. Also, I think the comment was also made that many of us are developing systems and resources that are serving the same populations, and not realizing where there may be shared experiences to collect data, to collect information from our families that are experiencing sort of the multiple parts of the system at once, and what that experience is like, and how can we better improve upon it. So a theme certainly throughout all of this has been the breaking down of silos, the reaching across our various, whether healthcare, social services, all the different parts of our communities, to not just develop programs, but also to share in the evaluation process, the building of data building, collecting data, so that we are able to learn from those lessons in real time together. It's not just me from the ER doing my study in the ER, but that I'm also talking to our school systems, to our case management systems, and so forth when I'm building out my projects.
Yes, I agree. And then, so one of the things that I was thinking about during this was that I think it was David Schoenfeld that said there was a total lack of evidence-based and no real attempt to collect evidence on prevention activities for children and students. It would be interesting to know how the government agencies that provide the grants and have the oversight could do some of that evaluation of evidence. And specifically, Tarah, do you have any thoughts? I mean, being at ATSDR, you've been through how you do evidence. So how would you go about doing that?
Oh gosh, I think that's a big challenge. I think sometimes what we've seen is, what can help is if you have people at the federal agencies who can take the best practices they've seen, and if you can get it written down and on paper and put out there in the world for others to use, that can be really helpful. You know, I think sometimes we're all a little bit reluctant to get something out there in the world for others to react to. But if you can bring groups together and put down on paper, well, now it's all virtual, not just paper on an internet site, some things that can be done before, during, or after or during disaster recovery that can help protect children and across all these different areas, then I think that could be really helpful. And it's that first step of like taking the best practice and just writing it down and putting it out there for others to follow. Because I think after a disaster, a lot of local community members, it is hard to know where to turn and to find good information and how to rebuild your community. And if there's something they can point to that says, hey, CDC, ATSDR, or ACF, or Save the Children, or Red Cross, somebody said this here, we can follow that, then I think that can be really helpful for community members.
Yeah, and I mean, it's easy in one way to think about what is the community and the human services sector. We think about child care centers and a lot of people, when you think about your child care center, or most of us in our income range, we're thinking about private for-profit facilities, not realizing that many, and certainly the ones that ACF helps support, are not for profit, and they're serving some of those who are financially disadvantaged in the country. And the same way with many of the other social supports and human services organizations. While there are organizations that are for profit, many, and in fact, the majority, probably almost all that serve the populations we're talking about in the last 2 days are not for profit. They're voluntary, they're organizations that are voluntary, and so it's a very different situation. So it's sometimes good to keep in mind that it's easy to think about how can we ask people to collect data and evaluate it. And it's one thing when you're a huge corporation, and it's another thing when you're a small not-for-profit that you don't have an extra 10 hours in your week to do that. So that being said, we have really come to the end of our time. And I want to thank everyone. First of all, I want to thank the Planning Committee, all of whom donated their time to this effort and took time out of their very busy schedules to do this for the National Academies, for the Administration for Children and Families, and for all of you, and for the people and the children that we serve. And I also want to take the time to thank all of the panelists who also donated their time. You all are amazing examples of what it means to be, in many ways, people that just serve your community and care greatly about children. And then finally, I want to thank the National Academies for putting on this workshop, and the Administration for Children and Families for supporting it. We are all stronger working on this together, and we can make our community stronger. So thank you all.